The HydroClean treatment is an exclusive treatment method with exceptional results for deeply cleansing the skin and restoring radiance to the face. The HydroClean treatment has two phases. Phase 1, deep cleansing with the thermoclean heating electrode. Phase 2, beauty massage. Conduct the consultation, which will allow you to personalize your client's skincare program. Skin preparation. Wash and sanitize your hands as well as all accessories. Preheat the electrode. The electrode is hot when the light stops blinking. Cleanse the client's face and neck with one-step cleansing water. Dry skin. Phase 1, deep cleansing with the thermoclean heating electrode. The heat emitted by the patented thermoclean electrode, combined with the cleansing gels, triggers hypersecretion in the sweat and sebaceous glands to eliminate excess sebum and toxins. In addition, the heating electrode helps open pores, making blackhead extraction easier. Apply 10 milliliters of cleansing gel that's best suited to your client's face. Universal cleansing gel, all skin types. Purifying cleansing gel, oily skin. The cleansing gels are compatible and may be applied to specific areas of the face. For example, purifying cleansing gel may be used on the T-zone, universal cleansing gel on the rest of the face. Verify the temperature of the electrode on your hand, then adapt it to your client's level of sensitivity. Place a thick layer of gel over the heating electrode before beginning step 1. Then, move the heating electrode back and forth over your client's skin, repeating each step 3 times. Underneath facial contours, over facial contours, above lips. Cheekbones, forehead, Move the heating electrode more slowly over the T-zone, which contains more sebaceous glands. Chin, sides of the nose, Forehead. Forehead. Remove the excess gel with a spatula. Then rinse. Proceed to extracting blackheads if necessary. Then apply lotion and dry skin. Phase 2. Beauty massage. Massage your client's face with a beauty massage cream serum for 5 to 7 minutes using your regular techniques. This massage helps drain skin tissue, regulate subcutaneous microcirculation, and relax facial features for a radiantly beautiful and rested face. Apply lotion and dry skin. Beauty enhancement. End by applying the cream best suited to your client's needs. Show your client these spectacular beauty results using the beauty mirror. At the end of the treatment, the skin is clear and radiantly beautiful. It is able to breathe. It's more receptive to the subsequently applied products. Make an appointment for the next treatment. All skin types, 1 treatment per month. Oily skin, 1 to 2 treatments per month. Give your client a beauty prescription which lists the products to be used between 2 salon treatments. In preparation for treatment, the beauty therapist consults with the client to determine her beauty goals. This consultation aims to define these beauty goals and to select the appropriate double ionization serum gels. Remove eye and lip makeup with eye cleansing gel. Next, cleanse with appropriate cleansing milk. Rinse and blot dry. Next, apply the cleansing exfoliating face lotion to the face and décolleté using circular movements. Avoid the eye contour. Its deep cleansing action dissolves all traces of makeup and impurities. Its exfoliating enzymes eliminate dead skin cells. Rinse. Tone. And blot dry. The skin is now ready for double ionization with the serum gels. The double ionization phase lasts 10 minutes. It requires the application of serum gels. These gels are twice enriched in ingredients, both of positive and negative charges, for greater treatment effectiveness. This process includes a first electrode application lasting 5 minutes, starting at the décolleté and moving up to the forehead. At the end of the first application, swap the electrodes from one hand to the other. Then repeat the procedure for a second identical application. Apply anti-wrinkle serum gel for eyes. Apply the neck bust décolleté firming serum gel. Apply one or more serum gels that you've chosen according to your client's beauty goals. Select the roller electrode button on the front of the machine. The roller ionizes serum gels on the flat surface of the face. The balls ionize serum gels around the eye, chin, and mouth. Each electrode application lasts 5 minutes and comprises 11 movements. Repeat each movement twice. Start by selecting a minimum level 5 setting, then adapt it to the sensitivity of your client's skin. For the first electrode application, hold the black negative electrode in one hand and the red positive electrode in the other. Set the timer for 10 minutes. First movement, neck and décolleté area. Second movement, chin. Third movement, lower cheeks. Fourth movement, lips. Fifth movement, cheeks. Sixth movement, laughter lines. Seventh movement, cheekbones. Eighth movement, eyes. Ninth movement, temples. Tenth movement, between the eyebrows. Eleventh movement, forehead. After the first electrode application, switch hands. Repeat the same procedure, moving from the décolleté up to the forehead. The ingredients with both positive and negative charges penetrate the skin deeply and rapidly. Remove excess gel from the face and décolleté with a spatula. If necessary, proceed with extractions. Rinse, tone and blot dry. Apply an even layer of OZ2 oxygenating emulsion, avoiding the eye contour. Select the high-frequency electrode button. Adapt it to the sensitivity of your client's skin. Respect a minimum level of 6 as setting. Set the timer for 5 minutes. Move the high-frequency electrode slowly over the décolleté, neck and face during these 5 minutes. Remove the OZ2 oxygenating emulsion with a spatula. Rinse, tone and blot dry. For a more specific hydradermy double ionization treatment, apply the eye lift serum on the lip and eye contour and the youth neck serum on the neck and décolleté before the massage phase. Apply the Massage Face Cream Serum, which is rich in regenerating and firming ingredients and is ideal for relaxing massage. Massage for 10 minutes to encourage toxin drainage, nourish the skin and freshen facial features. Select the eye and face masks corresponding to your client's beauty goals. Leave on for 10 minutes. Rinse, tone and blot dry. Finish the treatment by applying one or more care products that match the client's needs. Specific products for eyes and neck, serum and cream for the face. You've just been introduced to the Hydrodermy double ionization treatment. Results are incomparable. So that your client can see for herself how effective the treatment is, ask her to look at her face in a mirror. Facial features are toned, skin is soft and velvety. The face is fresh, radiant and younger looking. Make an appointment with your client for future care and prescribe the products needed between two treatments. Do a quick beauty touch-up with Masters Colors professional makeup products. You are about to discover the Hydrodermy Lift Eye Treatment. This specific treatment, performed in 35 minutes, treats the entire eye area. It achieves visible results, boosting a youthful appearance, reducing shadows, and regenerating tired eyes. This treatment also uses the anti-wrinkle eye serum gel, which penetrates deeply with its double ionization action. The ball electrodes follow specific movements on the contour of the eyes, providing complete drainage, and then stimulate the skin for a visible lifting effect. In preparation for treatment, the beauty therapist consults with the client to determine her beauty goals. This consultation aims to define these beauty goals and to select the appropriate serum gels. Carry out makeup removal on the eyes and then on the lips with the eye makeup remover. Then apply the cleanser appropriate to the skin type of your client, to the face and neck. Rinse. Tone. And blot dry with a tissue. Apply the anti-wrinkle eye serum gel to the contour of the eye, crow's foot, avoiding the lashes all the while. Select the ball electrodes button. Set to level 2 for drainage. Set the timer to 10 minutes. In order to perform complete drainage and eliminate the toxins, carry out the movements in the following order. For the first path, from the eyebrow to the jaw, one ball electrode remains fixed at the beginning of the eyebrow, the other moves over the forehead, to the temple, and then down to the jaw. Second path, from the inner corner of the eye to the temple, one electrode remains fixed by the sinus bone, the other moves along the contour bone under the eye to the temple. Third path, from the temple to the jaw. One electrode is positioned on the temple, the other moves down to the jawbone. Repeat each movement 4 times, slowly, on one eye, then on the other. For muscular stimulation, start by selecting level 5 and checking that the muscle contracts when the electrodes are moved, without the client experiencing any sensation of discomfort. Increase the timer to 10 minutes. Perform the movements in the following order. First movement, orbicular muscles of the eye. Firstly, an electrode remains fixed on the outer corner of the eye. The other moves along the contour bone under the eye to the inner corner of the eye, then returns to the temple with a back and forth movement. Then electrode remains fixed on the outer corner of the eye. The other moves along the brow bone with a back and forth movement. Second movement, orbicular muscles of the eyes. Firstly, an electrode remains fixed on the temple, the other moves along the contour bone under the eye to the inner corner of the eye and back, performing a circular movement. An electrode then remains fixed on the outer corner of the eye, the other moves along the brow bone with a back and forth movement. Third movement, frontal muscles. On the first path, one ball electrode remains fixed on the brow bone, the other moves up to the forehead. Repeat this movement for the second and third paths approximately 1 centimeter apart. For the fourth path, place the 2 electrodes on the lower eyelid, a half a centimeter from the outer corner of the eye. Move an electrode from the outside corner of the eye to the temple in a diagonal line. Repeat each movement 4 times, slowly, on one eye, then on the other. Remove excess serum gel with a spatula. Rinse, tone, and blot dry with a tissue. Apply the eye-lifting serum and massage until it penetrates to the contour of the eyes. Apply the modeling cream serum to the whole face and neck and eyelids. Perform a massage to the contour of the eyes. Apply the eye mask. And allow to rest for 5 minutes. Rinse, tone, then blot dry with a tissue. Complete the treatment by applying the treatment cream appropriate to the beauty objectives of your client, to her eyes, neck and face. The results of the Hydrodermy Lift eye treatment are visible immediately and are even more lasting if performed on a regular basis. So that your client can assess the full effectiveness for herself, suggest she does the mirror test. She'll see that tiredness is removed from the face, lines and wrinkles are smoothed away. Arrange an appointment with the client for her next treatment and prescribe the home care products necessary between treatments. Carry out a flash beauty treatment using the Masters Colors professional makeup products. You have just discovered the Hydrodermy Lift eye treatment. Hydrodermy Lift is a lifting treatment that rivals surgery. It rejuvenates facial features like a lifting treatment by stimulating the muscles in depth. During the 1-hour treatment, the beauty therapist performs the equivalent of a bodybuilding session on facial muscles, especially for those normally less used, which with age or tiredness can lose their tone. The ball electrodes are firstly used during a drainage phase to eliminate toxins, and then a further phase of muscular stimulation to increase the firmness and volume of muscles for a lifting effect. In preparation for treatment, the beauty therapist consults with the client to determine her beauty goals. This consultation aims to define these beauty goals and to select the appropriate serum gels. Remove makeup from the eyes and lips using eye makeup remover. Next, apply the cleanser suited to your client's skin type. Rinse and blot dry with a tissue. Apply the exfoliating cleanser with the fingertips, using circular movements to the whole face, neck and décolleté, avoiding the contour of the eyes. Its cleansing action will dissolve traces of makeup, and its exfoliating action will superficially eliminate dead skin cells through enzymes. Rinse, tone, then blot dry with a tissue. Apply the serum gel Age Logic or anti-wrinkle serum gel onto the entire face, neck and contours of the eyes in a thick layer. Select the ball electrodes button. Adjust to level 2 for drainage and take up the 2 ball electrodes. Set the timer to 10 minutes. The movements are applied from the top to bottom of the face to drain toxins and improve the blood and lymphatic circulation for a period of 5 minutes on each half of the face. First movement, the forehead. One of the ball electrodes remains fixed in a position above the beginning of the eyebrow, while the other ball electrode moves over the forehead to the temple. Repeat this movement on path 2, then on path 3, continuing the line down to the base of the neck. Second movement, the contour of the eyes. One ball electrode remains fixed by the sinus bone, while the other ball electrode moves along the contour bone under the eye to the temple. Then place one electrode on the temple, while the other electrode moves down to the jawbone. Third movement, laughter lines. One ball electrode remains fixed 1 centimeter from the nostrils, the other electrode moves along the laughter line to the jaw. Fourth movement, the neck. One ball electrode remains fixed on the neck, in line with the corner of the mouth. The other moves down the neck to the clavicle. Repeat this movement on paths 2 and 3 at approximately 1 centimeter intervals. Repeat all these movements on the other half of the face. For muscular stimulation, the movements are carried out from the neck, moving up to the forehead on one half of the face, then repeated to the other half of the face. Each movement needs to be carried out 3 times. Before beginning the stimulation phase, adjust the intensity according to the client's sensitivity, starting at level 5. Arrange the 2 ball electrodes one under each other and move one of the electrodes downwards to observe the contraction. Do this once again, increasing the intensity until a contraction is achieved, without the client experiencing any sensation of discomfort. With the intensity now set at an optimal level, adjust the timer to 10 minutes and start the stimulation phase. First movement, mastoids. One ball electrode stays fixed under the ear, while the other electrode moves down the neck to the clavicle bone. Repeat this movement on paths 2 and 3 at 1 centimeter intervals. Second movement, the masseter muscles. One ball electrode remains fixed on the jawbone, the other moves up along the masseter muscles, stopping in line with the cheekbone. Repeat this movement on paths 2 and 3. Third movement, zygomatics. One ball electrode remains fixed on the corner of the mouth, the other moves over the zygomatic major. Repeat this movement over path 2 for the zygomatic minor, moving the 2 electrodes up by approximately 1 centimeter. Fourth movement, the orbicular of the eyes. 1 ball electrode remains fixed at the corner of the eye. The other moves along the contour bone under the eye to the inner corner of the eye in a back and forth movement. On path 2, 1 electrode remains fixed on the temple. The other moves along the eyebrow in a back and forth movement. Fifth movement, the frontal muscles. 1 ball electrode remains fixed on the brow bone. The other moves up to the forehead. Repeat this movement on paths 2 and 3 at 1 centimeter intervals. Repeat all these movements 3 times to the other half of the face. Remove the excess serum gel with a spatula. Then rinse, tone, and blot dry with a tissue. For a more specific hydrodermy lift, apply the eye lifting serum to the contour of the eyes and lips, and the long life neck serum to the neck and décolleté before the massage. Apply the modeling serum cream, which is rich in active regenerative and firming ingredients and gives smoothing results. Perform the massage for 10 minutes to drain the toxins, nourish the skin, and remove tiredness from facial features. Apply the eye mask to the eye contour. Then apply the energy lift mask to the face, neck, and décolleté. Allow to rest for 10 minutes. Remove excess mask using a spatula. Rinse, tone, and blot dry with a tissue. Complete the treatment by applying the treatment cream appropriate for your client's beauty objectives. To the eyes, neck, and face. The results of the hydrodermy lift treatment are immediately visible and even more lasting if performed on a regular basis. So that your client can assess the full effectiveness for herself, suggest she looks at her face in a mirror. She will observe that her face looks several years younger. The face is rejuvenated, tiredness is removed from the features, lines and wrinkles are smoothed away, the skin is more supple and firmer. Make an appointment with the client for the next treatment and prescribe for her the home care products required between treatments. Do a quick beauty touch-up with Masters Colors professional makeup products. You've just discovered the hydrodermy lift treatment. The aromatic facial treatment is personalized according to your client's beauty goals. You will choose the appropriate essential oils for her type of skin. In approximately 45 minutes, this treatment based on essential oils will make skin more beautiful, revitalize it, and create a long-lasting glow. The aromatic treatment is carried out in 2 steps. Step 1. Essential oils are worked into the skin using Guinot massage techniques. Step 2. You prepare the aromatic mask with fig extracts in front of your client. Before starting treatment, consult with your client to determine her beauty goals and select the appropriate essential oils. Remove eye and lip makeup with Hydra Démaquillant Yeux. Select the appropriate milk for your client's skin type. Apply lotion. Blot dry with a tissue. Apply small dabs of gommage biologique to face, neck and upper bust. Scrub using circular movements. Start at the neck, then move up to the forehead. Continue until milk becomes an oil. Avoid the eye contour. Rinse. Apply the lotion corresponding to your client's skin type. Then blot dry with a tissue. The aromatic relaxing massage with essential oils lasts 15 minutes and includes 3 steps: the Serenity Welcome movements, the 10 exclusive Guinot movements, massage by the beauty therapist. Massage is based on the advantages of essential oils. There are 5 essential oils to treat specific beauty goals. Serenity Essential Oil calms reactive skin. Vitality Essential Oil regenerates and stimulates skin. Comfort Essential Oil nourishes and repairs dry skin. Balance Essential Oil cleanses and regulates oily secretions. Energy Essential Oil tones and stimulates tired skin. Choose Serenity Essential Oil. Start the relaxing massage using Serenity Welcome movements to establish contact with your client and make her feel at ease. Repeat each movement twice. Movement A. Draw 1 or 2 fingers back and forth across the client's forehead. Apply pressure to her upper lip. Go back and forth over the plexus. Movement B. Back and forth V-shaped smoothing movements over the upper bust and neck. Movement C. Smoothing of the nape, followed by pressure on the occipital bone. Next, select the essential oil corresponding to your client's beauty goals. Do the 10 exclusive Guinot movements to treat each area of the face: forehead, eye contour, cheeks and cheekbones, lip contour, chin and facial contour. Repeat each movement 3 times. First movement. Alternate horizontal smoothing movements across the forehead. Second movement, smoothing from the middle of the forehead to the outside. Third movement, circular pressures on the temples. Fourth movement, smoothing from the inside to the outside of the eye contour. Fifth movement, smoothing from the bottom of the nose towards the cheekbones. Sixth movement. Rotating pressure on the jaws in the direction of the cheekbones. Seventh movement. Smoothing that descends from the cheekbones to the collarbones. Eighth movement. Back and forth half circles with the thumbs around the lips. Ninth movement. Alternate smoothing movements with the hands over the facial contour and neck. Tenth movement. Downward smoothing from the jaw to the collarbones. Continue with your own massage. Continue treatment with the aromatic mask enriched with fig extracts. This polymerizable mask provides mild exfoliation that leaves the skin glowing. Pour the contents of an aromatic mask packet into a bowl containing 80 milliliters of warm water. Mix until smooth and consistent. Apply a thick layer of the mask to the face and neck using a spatula. Leave it on for 10 minutes. During this time, write a prescription for the products needed between two treatments. Delicately remove the aromatic mask, starting at the neck, then moving up to the forehead. Apply lotion blot dry with a tissue. Finish the treatment by applying one or more care products that match your client's needs. Specific products for eyes, neck, serum, and cream for the face. Results are incomparable. So that your client can see for herself how effective this treatment is, ask her to look at her face in a mirror. Next, go over the results together, adding your beauty expertise. From the end of the treatment, the face is more relaxed looking, skin is radiant and fresh. Make an appointment with the client for future care and prescribe the products needed between two treatments. Do a quick beauty touch-up with Masters Colors professional makeup products. You now know all about the aromatic facial treatment. For women who want a radiant and younger-looking skin, Guinot has created the Beauté Nerve Double Peeling Treatment. It contains fruit acids for cellular anti-aging, lightening, youthful radiance, and anti-pigmentation. In 45 minutes, the face becomes radiant, younger, the skin is rejuvenated. The treatment begins with a consultation to establish the client's beauty objectives. The products used are technically advanced, They must be applied according to the recommended treatment procedure. The treatment consists of 3 key actions: double peeling, peel in, peel out; Dermanove, Clary mask. Proceed to a complete cleansing process using products specific to the client's skin type. Firstly, remove makeup from the eyes using Hydra Démaquillant Yeux. Then any trace of lipstick. Next, remove makeup from the face and neck with milk and lotion makeup removers. Then rinse with moist gloves, tone, and blot dry the face. This critical stage of the exfoliation process is performed in 2 steps. The first is to apply the gel peel-in to separate dead cells from living cells. The peel-in gel with fruit acids separates dead cells from living cells. Apply the peel-in gel to the face and neck using a brush, avoiding the eye area. Leave the peel-in gel on the skin for 5 to 9 minutes, depending on the sensitivity of the skin. For a more intense treatment that lightens pigmentation, leave on for 9 minutes. Remove the peel-in gel using a spatula. Rinse and lotion without drying. In the second stage, apply the peel-out mousse in a thick layer, using circular movements on the skin, lightly buffing for 3 minutes. The peel-out mousse absorbs and captures dead cells in order to eliminate them and neutralize the fruit acids. Rinse gently. Apply lotion. And dry. When double peeling is complete, new skin appears. It is immediately lighter and more radiant. After the exfoliating peeling phase, the next step deeply regenerates the skin with Guinot's Dermanove serum. The Dermanove serum enables deep cellular regeneration after the double peeling. Apply the regenerating Dermanove serum in circular buffing motions for 4 to 5 minutes. Next, apply the Clary mask immediately without rinsing or applying lotion. Clary mask with vitamin C has 3 major effects. It lightens pigmented skin. It reveals a more radiant skin. It regenerates elastic fibers. Prepare Clary mask with a double sachet. Pour the Clary mask base and powdered pure vitamin C into a bowl. Then add 30 milliliters of water. Mix vigorously in order to obtain a smooth consistency. Apply Masque Yeux onto the eyelids and the surrounding eye area. Apply the Clary mask to the face and neck using a spatula. Leave on for 10 minutes to activate. Remove the mask using a spatula. Rinse carefully. Apply lotion, then blot dry. Finish with the application of beauty products suitable for the client's skin needs. Reveal the results to your client using a mirror. After the Beauté Neuve double peeling treatment, the skin is replenished, radiant, and appears younger. The complexion is bright and glowing. Arrange the client's next treatment appointment immediately. Offer her beauty treatment products that would work well with her skin. Carry out a flash beauty treatment using the Master's Colors professional makeup products. You have just discovered the Beauté Nerve Double Peeling Treatment.
With age, fatigue, after a pregnancy or after prolonged exposure to the sun, the face starts to show the signs of premature aging, particularly loss of firmness. The liftosome treatment helps renew the skin's elasticity, tone, and firmness, restoring a youthful appearance to the face and skin. The pro-collagen in the liftosome treatment restores and firms skin in depth. The heat therapy from Thermolift Mask promotes the penetration of the in-depth firming active ingredients and rehydrates the epidermis. A radiance-promoting and firming treatment, Soin Liftosome offers unique results for tired skin. The liftosome treatment comprises 3 phases. Phase 1, the Pro-Collagen Concentrate. Phase 2, the Thermolift Mask. Phase 3, the Anti-Age Serum. Before beginning the treatment, decide with your client on her beauty aims. Carefully clean your hands with a disinfectant wipe. Remove eye makeup with Hydra Démaquillant Eye Makeup Remover. Then cleanse the lips. Cleanse your client's face with the appropriate Hydra cleansing milk and lotion for her skin type. Rinse with water using mitts or cleansing sponges, then apply lotion. Dry the skin with a tissue. Apply a thin layer of exfoliant to dry skin, avoiding the eye contour area. Leave product on for 2 or 3 minutes. Rub with light circular movements. Rinse your client's face, then apply a lotion. Dry the skin with a tissue. Open the sachet of concentrate and apply the entire sachet to the face and neck, avoiding the eye contour area. The concentrate must be applied in a thin layer. Do not work in. Soak cotton pads in lotion. Place them over the client's eyes. Then apply a piece of gauze all over the face and neck, taking care to cut a slit for the client's nose beforehand. The gauze must cling to the face for improved adhesion of the mask and to facilitate penetration of active ingredients. Quickly and briskly, mix a sachet of mask with 75 milliliters of cold water until a smooth, even paste is obtained. Using a spatula, apply the mask in an even layer directly onto the gauze, all over the face and neck. Apply thinly over the windpipe. To improve the diffusion of heat, cover your client's eyes and lips. The mask gradually heats up after the first 7 minutes of application. Leave the mask on for 15 minutes. During these 15 minutes, you can give your client a hand massage and complete her confidential card and her beauty prescription. After 15 minutes, detach the mask by gently pulling on the sides of the gauze. Rinse the face and neck with water. Finish with the lotion. Dry with a tissue. Open the sachet of anti-age serum and apply to the whole face, neck, and décolleté. Perform gentle stroking massages. After the treatment, apply the specific creams to lips, neck, eyes. followed by the Liftosome cream or another product appropriate to the client's needs. Show your client the results in a mirror, allowing her to judge the incomparable firmness and radiance of her skin. Make up your client with the Masters Colors Treatment makeup products. For even better results, offer your client a skincare package and fix with her the date of her next appointment in the salon. The Liftosome treatment is recommended as an intensive course of 3 treatments, 1 per week. It is also possible to propose a monthly maintenance treatment between 2 hydrodermy.